Here's something I need you to hear right now, and it might change the way you think about your health forever. Most people believe that neuropathy, that burning, tingling, or numbing sensation in their hands and feet, is just a diabetes problem. They think, I don't have diabetes, so I'm safe. Or they believe it's just something that happens when you get older, something you just live with, something you manage with pain medication and hope for the best. That belief is costing people their quality of life. And today I want to set the record straight. My name is Dr. Zeno Phantom, and I've been practicing functional and integrative medicine for over 15 years. Every week in my clinic, I see patients who've been handed a prescription for nerve pain, gabapentin, amitriptyline, opioids, with no explanation of why their nerves are being destroyed and no roadmap to actually fix the problem at its root. That ends today. Let me tell you about one patient. A 58-year-old high school teacher named Marcus, a man who came to me complaining of persistent burning in both feet, severe fatigue, brain fog so bad he couldn't get through a lesson without losing his train of thought, and a tingling in his hands that had been progressing for 2 years. He'd been to 2 neurologists. He was told he had idiopathic neuropathy, which essentially means nerve damage we can't explain. He was put on medication. Nobody asked what he ate, what his blood sugar looked like after meals, or whether he was deficient in any essential nutrient. When we ran a comprehensive metabolic panel, his fasting glucose was 108, technically normal, but his post-meal glucose was spiking to 189. His B12 was sitting at 201 pg/ml. His inflammation markers were elevated. Within 6 months of targeted interventions, his foot pain decreased by 70%, his energy returned, and he was back to teaching full days without fatigue. Marcus is not an outlier. He is the rule. Here's the statistic that should wake everyone up. According to the American Diabetes Association, approximately half of all people with diabetes develop some form of nerve damage. And peripheral neuropathy is already present in a significant percentage of people at the time of their diabetes diagnosis, meaning it had been silently progressing long before anyone caught it. Yale Medicine estimates that neuropathy affects more than 20 million Americans right now, and the majority of those people have no idea what's actually causing it. Most people miss this because they're focused on symptoms, the burning, the numbness, the pain, instead of the environment inside their body that is quietly dismantling their nervous system one nerve fiber at a time. Here's what matters for you today. Your nerves don't just randomly break down. They are destroyed by specific, identifiable, largely reversible biological insults. And today, I'm going to walk you through exactly 6 of them. The 6 most powerful nerve-destroying forces hiding inside the modern body. I'm going to explain the science in plain language, show you what's really happening physiologically, and give you a concrete protocol you can start implementing today. Because your nerves are not just about pain. They control your digestion, your heart rhythm, your balance, your bladder, your sexual function, your ability to detect heat and cold. When your nerves go, your life quality goes with them. Pay close attention. This one matters. Here are the 6 science-backed insights we are going to cover in today's video. Point 1. Why chronically elevated blood sugar, even borderline sugar, is essentially a slow-acting acid eating away at your nerve fibers from the inside out, and what the research says about when the damage actually begins. Point 2. Why insulin resistance, not just diabetes, is independently destroying your nerves right now, and how this metabolic dysfunction starves your peripheral nerves of the growth signals they need to survive. Point 3. The myelin crisis. Why the protective sheath around your nerves is eroding, and how a single widespread nutritional deficiency is the hidden accelerant most doctors never test for properly. Point 4. Why the tiny blood vessels feeding your nerves are being choked off by advanced glycation end products, sticky, toxic compounds that form when sugar and protein fuse in your bloodstream, and how to stop their formation with what you eat every day. Point 5. The inflammation connection, why chronic low-grade systemic inflammation is not just background noise but an active destroyer of nerve tissue, and the three dietary patterns that either fuel it or extinguish it. Point 6. The lifestyle accelerants, why physical inactivity, poor sleep, chronic stress, and alcohol are not just bad habits, but direct neurotoxins in the context of already compromised nerve health, and the specific daily habits that reverse the damage. Let's go deep on each one. Point 1. The blood sugar poison and why borderline is already too late. And this one surprises almost every patient I see, because they walked in thinking their sugar was fine. Most of my patients tell me, "Doctor, my blood sugar is normal. My doctor checked it. I'm not diabetic, so that can't be causing my nerve problems." They assume there is a clean line between safe and dangerous, and that anything below the diabetes threshold is perfectly harmless to their nervous system. But here's what's actually happening inside your body. Your peripheral nerves, the long, thin fibers that run from your spinal cord all the way to your fingertips and the bottoms of your feet, are among the most metabolically demanding structures in the human body. They require a constant, stable supply of glucose and oxygen delivered through microscopic blood vessels called the vasa nervorum, the nerve's own private blood supply. When blood sugar is chronically elevated, even in the borderline or pre-diabetic range, something destructive begins. Excess glucose enters the nerve cells independent of insulin. It floods in regardless, and gets diverted into what biochemists call the polyol pathway. Your body converts that excess glucose into sorbitol, which then converts into fructose inside the nerve cell. This process burns through NADPH, one of your body's most critical antioxidant defense molecules. Without NADPH, your cells cannot regenerate glutathione. Oxidative stress floods the nerve cell. The mitochondria malfunction. The nerve fiber begins a slow, progressive process researchers call dying back neuropathy, where the nerve deteriorates from the farthest point inward, starting at your feet. Think of your nerves like long underground electrical cables running beneath a city. These cables have a protective rubber coating around them. Now imagine that the soil around those cables becomes slightly acidic. Not catastrophically, not enough to trigger an alarm, but consistently, day after day, month after month. That coating begins to corrode. The cable still works at first, but slowly the signals get disrupted. Eventually, you get sparks, misfires, or complete silence. That is precisely what elevated blood sugar does to your peripheral nerves. It creates a biochemically corrosive environment that silently strips away the protective coating year by year. Research published in PMC and cited by Johns Hopkins Bloomberg School of Public Health found that the estimated prevalence of peripheral neuropathy among adults with diabetes in the United States is approximately 28%, but that over a lifetime, it climbs to affect nearly 50% of all diabetic patients. More critically, epidemiologic studies over more than a decade have established that intermittent hyperglycemia and insulin resistance associated with prediabetes may be sufficient to damage distal nerves long before anyone receives a formal diabetes diagnosis. My recommendation for every patient over 40 is this: perform what I call a post-meal glucose check, not just a fasting blood sugar, a reading taken 90 minutes after your largest meal. Your fasting sugar can appear completely normal, while your post-meal spike is quietly scorching your nerve fibers every single day. A healthy post-meal reading should stay below 140 millodal. If yours is consistently above that, your nerves are in a corrosive environment right now, regardless of what your fasting number says. Not next month, not at your next annual physical. Start tracking your blood sugar response to food this week. Point 2. Insulin resistance. The nerve starvation no one is talking about. And this one, almost nobody is talking about this one. And it may be the most important thing I share with you today. Almost every patient I've seen with early neuropathy says the same thing. But my doctor told me I'm not insulin resistant. My fasting insulin is okay. It's not my metabolism. They believe insulin is simply a blood sugar regulator, a key that unlocks cells to let glucose in. And they believe that if their glucose is okay, their insulin is fine. End of story. But here's what's actually happening inside your body. Insulin is not just a blood sugar manager. It is a powerful neurotrophic factor, a biological signal that tells your nerve cells to survive, grow, repair, and maintain their protective myelin coating. Peripheral sensory neurons, the nerves in your hands and feet, actually have insulin receptors on them. They respond to insulin the same way your muscle cells do. When you develop insulin resistance, your nerve cells become insulin resistant too. And this means the repair signals that keep your nerves healthy are being blocked. Your nerves are being functionally starved, even in an environment of normal or elevated blood glucose. Research from the Journal of Frontiers in Neuroscience has confirmed that insulin dysregulation, both deficiency and resistance, independently contributes to neuropathic changes in sensory neurons. And a study published in PMC found that insulin resistance is independently associated with peripheral neuropathy, even after controlling for other features of metabolic syndrome. This is huge. Your nerves can be damaged not because your sugar is high, but because your cells have stopped listening to insulin properly. Imagine your nerves are like a team of construction workers who repair and maintain city infrastructure. Insulin is their foreman, the one who shows up with the tools, the materials, and the instructions for the day's repair work. When insulin resistance sets in, it's as if the workers can no longer hear the foreman. The instructions are being sent, the tools are there, but the workers can't receive them. So the infrastructure begins to crumble. Not from an obvious catastrophe, but from the slow, invisible failure of maintenance. My recommendation? Incorporate at minimum a 20-minute walk after your evening meal, not a strenuous workout on the brisk walk. Research consistently shows that post-meal movement dramatically lowers insulin resistance, reduces post-meal glucose spikes, and enhances peripheral nerve regenerative capacity. Not next week. After your next meal. Walk 20 minutes. Start tonight. Point 3. The myelin crisis. Your nerve's insulation is disappearing. Most of my patients who come in with burning, tingling, and electric sensations in their extremities have never had their vitamin B12 properly assessed. And even when they have, standard serum B12 testing is notoriously poor at detecting functional B12 deficiency. You can have a normal lab value and still have deficient B12 activity at the cellular level. Vitamin B12 is essential for the synthesis of myelin, the protective sheath around nerve fibers. When B12 is low, myelin degrades, signals slow down, and symptoms begin. Research confirms that B12 deficiency directly damages the myelin sheath and impairs nervous system function. My recommendation? Get a complete B12 panel, including methylmalonic acid, MMA, and homocysteine, and ensure adequate intake through diet or supplementation. Point 4 and 5, AGEs plus inflammation. Advanced glycation end products, or AGEs, form when sugar and protein fuse in the bloodstream. These compounds damage the small blood vessels that feed your nerves. They reduce blood flow, they increase inflammation, and they accelerate nerve damage. At the same time, chronic low-grade inflammation further damages nerve tissue and blood vessels. This creates a compounding effect. My recommendation? Avoid high-heat cooking methods like frying and grilling. Use moist cooking methods like steaming or boiling. Replace refined oils with healthier fats. Eat fatty fish rich in omega-3s. Reduce ultra-processed foods. Start with one change this week. Point 6. Lifestyle accelerants. Physical inactivity, poor sleep, stress, and alcohol all directly damage your nerves. Lack of movement reduces blood flow. Poor sleep blocks nerve repair. Stress increases inflammation. Alcohol damages nerve tissue and depletes essential vitamins. My recommendation? Walk daily. Sleep 7 to 9 hours. Reduce stress. Limit or eliminate alcohol. Final summary. Your nerves are not randomly breaking down. They are being damaged by blood sugar spikes, insulin resistance, nutrient deficiencies, inflammation, poor lifestyle habits. The good news? All of these are reversible with the right actions. Start simple. Check your blood sugar. Improve your diet. Walk daily. Protect your sleep. You don't have to accept nerve pain as normal. Your next move starts today.